Welcome to Wednesday, the last day, final session of our forum. I hope you've been having a good time and learning a lot. I know everyone's been looking forward to this discussion today on pension reform. It was actually 1 year ago this month that the Governor, Jerry Brown, first unveiled his 12-point pension reform proposal. As you know, a conference committee was convened by the legislature on pension reform. They went to work, and our team went to work evaluating costs and other impacts of the proposed changes. CalPERS participated in multiple hearings, public hearings at the legislature, presenting data, cost information, and answering questions in a technical support function so that legislators could make sound judgments on pension reform. It was a very long year of speculation and debate among all the pension advocates and stakeholders and critics. So what has emerged into law, as we all know, is a level of reform that lowers pension benefits for new public sector hires, provides cost savings for employers in future years, while maintaining a defined benefit plan for public sector workers. While there are many opinions out there about the reforms and whether they're good or bad, and while they don't satisfy everyone, we believe they're a positive and significant step in ensuring that public pensions are sustainable, secure, and cost-effective in the long term. But for today, the question is what next, and what do we do now, and how do we implement? Today, we've convened for you a panel of CalPERS experts to discuss the laws and how we at CalPERS plan to implement them. As you'll hear, there are some areas that we're still looking into, and we'll let you know this morning what those are. By now, most of you should have received the document that's called A Guide to Pension Reform. It was in the packets that you received when you registered, and we also just posted it on our website. And as new information comes available and as we get new answers as we go through the coming weeks, we'll continue to update that post on the website. So with that, I'd like to introduce our panel for this morning. I'm going to start with Danny because he's going to lead the panel. Do you want to? Danny Brown is our Chief of Governmental Affairs, and he's going to lead and moderate the panel this morning. To his left is Karen DeFrank. She's the Chief of our Customer Account Services Division. To my immediate left is David Lamoureux, our Deputy Chief Actuary, and then at the far left is Jenni Krengel, our Assistant Chief Counsel. This team and their staffs have worked truly tirelessly during the drafting of the legislation, all the public hearings, and then after passage to make sure that we can all implement in a timely fashion. And they're true models of what it means to be a public servant in a time of change. So with that, please join me in welcoming the panel.
Good morning, everybody. Thanks for sticking around to this last day and coming to this panel discussion. I can't remember how many years I've been coming to this conference. I think it's been at least 10. This is the first time they've actually asked me to sit up on the general session. I'm not quite sure how I feel about that yet, but maybe at the end of this hour and 15 minutes, I'll let them know whether or not I want them to ask me back for the general session. For those that came to the Ledge update yesterday, you probably heard me say that I literally spent about the last 3 weeks looking at this piece of legislation, trying to figure out how CalPERS is going to implement it. The three individuals on this panel were part of that working group, among others, and so we have spent a lot of time looking at this, and for old time's sakes, we actually sequestered ourselves in a hotel room last night to continue to look at it. So our goal here is to hopefully tailor our presentation to answer many of the questions that we've collected over the last 3 days, and we thank you for stopping by the booth and providing us your questions, and it helps us try to figure out, how to best implement it, knowing what your guys' concerns are. So we will hopefully answer many of your questions just during the presentation. Once we're done with our presentation, we'll answer some of the other questions that we have collected, and with whatever remaining time, we'll take questions from the group. So we'll just start off with some basic information. What is AB 340? Some of the relevant dates. It was adopted by the legislature on August 31st. signed by the governor on September 12th and becomes effective on January 1st for the most part. There's one provision dealing with the alternative retirement program, and so unless you're a state employee, it doesn't impact you. That doesn't take effect until July 1st. I guess the significance of those dates are we're really still less than 2 months out from seeing the legislation and the governor signing it, and that's really not much time to analyze a complex piece of legislation like this, but we are doing our best. The bill consists of the California Public Employees Pension Reform Act, so it has provisions in what's kind of the general government code section that applies to all retirement systems. And then it also amends the Public Employees Retirement Law, the 37 Act County Law, the Teachers Retirement Law, the Judges Retirement Law, and the Legislators Retirement Law. So a lot of changes in there. And it applies to all state and local public retirement systems and their participating employers. I think the first thing we want to do starting off this conversation is a new member definition. Again, for those that came to my session yesterday, some of this stuff will be repetitive, but I don't know if you can hear this enough for it to sink in. But I think when we're discussing the bill and PEPRA's provisions, we really need to understand the definition of new member. I know when you approached me at the pension reform booth, I always made sure that we were using the same terms and like terms because we like to say new employee, new hire, but really need to make sure we understand the definition of a new member so that we know how these provisions apply. So the first one is obviously easy. It's that person that you hire that has never been in a public retirement system or worked for another public employer, and that person would be considered a new member, someone that you hire after January 1st, 2013. The other provision applies to someone that you may hire that worked for a public employer under another public retirement system, so say for like a 37 Act County system. So if you were to hire someone away from another retirement system and they had a break in service of greater than 6 months, then that person would be what's called a new member. The other way you can be a new member is if you hire someone from another public employer that is within CalPERS, and that person had a 6-month break in service. They would be a new member. So if you hire someone and they left that employer on Friday and joined you on Monday or 2 weeks later, they would not be a new member, and they would go into your formula you had in place on December 31st, 2012. If you hired someone that had a break in service of greater than 6 months, then they would go into that new PEPRA formula, 2% at 62. The other thing that's important to remember is this break in service of 6 months only applies if you hire someone from another employer. So if the person worked for you, left, went into the private sector, worked 10 years in the private sector, and you hired them back, they would not be considered a new member. They would be an existing member going back to their existing formula. It's also I think there was at least one person from the state here in my other earlier session, so it's important to know that state agencies, the state is considered one employer, so if you work for one state agency, leave, go in the private sector for 5 years, come back to another state agency, that's still considered one employer, and you would not be a new member. And that is the same for school districts. You can move around school districts. The schools are considered one employer. It's not school districts within one county office of education. It's all school districts are considered an employer. So you can have a break in service of greater than 6 months and move between school districts and not be considered a new member.
So by now you should all know 4 new benefit formulas were added to new members. There's the one formula for the miscellaneous employees, the 2 at 62. The one thing I'd like to point out about this formula is new members under this formula will not be allowed to retire before the age of 52. Currently today, your miscellaneous employees can retire as early as age 50, so that's one change with the new formula, is age 52 is the earliest age a new member will be able to retire under the miscellaneous formulas. They've added 3 formulas for the safety employees, but for safety employees, age 50 is still the earliest retirement age. So you're probably all wondering which formula will apply to my employees. The bill as written says that your new members should go in the formula that at normal retirement age as the closest factor but lower than the current formula. So for miscellaneous employees, it's fairly simple. There's only one formula, therefore most of you will go to the 2 at 62. There is one exception to this. There is a formula on the books at CalPERS called the 1.5 at age 65. To date, we only have 3 employers at CalPERS that have contracted for that formula. Those 3 employers will be able to remain in that formula, and that their new members will go in the 1.5 at 65. This is also the only formula that's currently in the books at CalPERS for which an employer will be able to contract for in the future. However, there are some restrictions with this formula, one of them being your members have to be in Social Security. So if it's something that interests you going forward, I would urge you to contact your contracts analyst to discuss. For the safety formula, 3 formulas were created by the bill, the 2 at 57, the 2.5 at 57, and the 2.7 at 57. For CalPERS local agencies and schools and the school police, basically they're going to go in either the 2 at 57 or the 2.7 at 57 as shown here. I think 95% of our employers are either in the 2 at 50, 3 at 55, and 3 at 50, so most of the CalPERS members will go to the 2.7 at age 57. The 2.5 at 57 that was added by PEPRA today only applies to some of the state safety categories. The last thing I'd like to mention on this is for those of you that participate in the risk pool at CalPERS, in November, where we'll be going in front of our board and asking the board to create 2 new risk pools for local agency. One for the 2 at 62 formula for the miscellaneous members, and 1 risk pools for the 3 new safety formulas. We will be having different rates within the pool by using what you're probably familiar with, our surcharges, to make sure that those in the 2 at 57 pay less than those at the 2.7 at 57, but they'll all be going into 1 risk pool.
Okay, so the next question is, how do we implement these new formulas? And the relationship between CalPERS and the employers is governed by law. So the provisions of PEPRA will automatically take effect on January 1st. The contracts will not need to be updated by that time frame. And we will be implementing the new formulas and the 3-year final compensation on January 1. The existing optional benefit provisions and exclusions that are in the current contract will be transferred to those new tiers for the new members. And CalPERS will be updating the agency contracts over a 2-year period or when an employer contacts us to amend their contract.
So the next major provision that applies, again, just to new members, is the salary cap on pensionable compensation. So this only caps what counts towards your retirement. It doesn't mean that it has a salary cap where you can't pay anybody a salary above this amount. But the initial cap is tied to Social Security contribution and wage base for 2013, which will be $113,700. So if your formula is tied or if you're in Social Security, those members will have a pensionable salary cap at $113,700. If you're not in Social Security, then it would be 120% of that number, which is $136,440. So it uses Social Security for the initial cap, but after that, it is adjusted annually by the CPI. So the actuaries will annually adjust that each year and let you know what that new cap is. The bill also has, in that provision, it also says that you cannot offer any other type of defined benefit plan to those members that are capped to that salary or that compensation above the cap. However, you can provide a defined contribution plan for that salary above the cap, but there are some restrictions. I believe that the contributions that an employer can pay towards that defined contribution can't be any more than you pay into the DB plan below the cap. The bill also has some what they like to refer to as anti-spiking provisions for new members. So all new members' final compensation will be based on the highest 3-year average pensionable compensation. It also includes a provision to say that for your current employees, if you currently have 3-year final comp for your current employees, you cannot amend your contract to provide 1-year final comp for those people. So if you're at 3 years, it's locked in at the 3 years. It also, for new members, provides a new definition for pensionable compensation. If you're familiar with CalPERS and our current laws under the PERL, we use the word compensation earnable. They now have introduced a new term called pensionable compensation. So it is different definition for these new members. I know this is one of the areas that we have received questions about. It's an area that we are still analyzing and trying to determine what exactly will be considered pensionable compensation. As we do this review, the way the bill, we'll have to analyze what's currently in the bill's provisions, which are such thing as has to be normal monthly rate of base pay, it has to be paid to similarly situated employees, and it has to be pursuant to publicly available pay schedules. It also actually includes in the bill things that cannot be included, such as overtime, uniform allowances, bonuses. So as we analyze the bill, we'll need to take those things into account. And at some point, we will, have to adopt regulations to let you know what we plan to let you include for pensionable compensation. There will be a chance obviously for public comment as we go through the regulation process. This is also one of the things I meant to mention at the very beginning that I didn't, is as we're going through this whole process of reviewing the bill, we are checking with the legislative staff, with the administration, with other organizations, and in particularly other retirement systems, 37 Act County, CalSTRS, to make sure that we can implement this as consistent as possible with these other retirement systems. And again, this is one of those areas where we are reaching out to the 37 Act County system and CalSTRS systems to make sure that we are all interpreting this new definition the same.
Okay, normal cost. This is now a new term that's been added in the law, and I know many of you are confused. I think beside actuaries, nobody else is, I think only the actuaries are not confused about this, but basically normal cost is simply the cost of 1 year of benefit. It's the cost expressed as a percentage of payroll. If you look at your current valuation report, what you've been used to see, in the past we've always shown to you only the employer normal cost. So what we're really talking about here, it's the employer normal cost you've seen all along in your report, plus the employee contribution that employees have been paying. It does not include anything employers currently pay toward unfunded liabilities. To make it easier, in this year's valuation report, we've added a new line item called the total normal cost. So when you get your report later next month, you will be able to see what the total normal cost is for your current members. And if you have any questions after you get it, I would simply urge you to contact your CalPERS actuaries. They'll be more than happy to help you explain, show you where it is in the report and explain it to you.
Okay, the next thing we'd like to keep forgetting the mic. So the next thing would like to look at is the member contribution rate. For state members, it's real easy. All new and current members will continue to pay what's currently defined by statute. So for the state employees, it's defined in the PERL what they're going to pay, and all the new members, all the state employees that are hired that are new members will just continue to pay the same as the current employees. For public agencies, school districts, judicial branch, their initial contribution for these new members will be the greater of 50% of the normal cost for the defined benefit plan, or if the current contribution rate of similarly situated employees. And you probably have heard us say at the booth and in my session yesterday that this is, again, one of those areas where it's still unclear. The bill did not define what similarly situated employees means, so we're still looking at this. So we'll be one of the areas that we will have to come back later and provide more information on. The bill also prohibits employer-paid member contributions for new members. but then later on adds this caveat of unless an MOU is impaired. So under this whole area of what new members will pay as far as their contribution rate is still an area that is not, has not been decided, and I know you guys have a lot of questions on that. So we will be looking to provide that information as soon as possible. But the bill says that if an MOU is if you have an MOU that's impaired, then this EPMC may still be allowed. But once that contract is expired, you would not be able to, or I should say, is that once that MOU is expired or you renew it, you would not be able to add EPMC for your new members going forward. So for current members of public agency and school districts, the bill does encourage the 50-50 sharing of normal cost and the elimination of EPMC, but I think what's important to point out is it's not required. So I know there's a lot of confusion about whether or not EPMC goes away for current members or whether or not they have to pay half the normal cost. So while the bill kind of puts that out there as a goal, it is not something that's required or mandated to do. It does add a provision for employers to require or to impose a 50-50 cost sharing of normal cost under certain situations. So you would still have to go through the regular collective bargaining process, and if you hit an impasse and go through those impasse procedures, you can require that those employers pay additional contributions. However, they are capped at 8% for miscellaneous employees, 12% for local police officers and firefighters, and 11% for other safety. So there is a way for you to impose that if you choose to, but again, it's not a requirement that you impose. It's just a tool that was added for the employers. And then on EPMC, because again, a lot of questions about whether or not EPMC goes away. It's not required that you eliminate EPMC, so it's really just the same rules apply now for EPMC that are in the PERL. And the PERL does have provisions that allows you to reduce or eliminate EPMC. So you would, if you wanted to go that route, you can, through collective bargaining or through the normal procedures in the PERL, you can look to reduce your EPMC. Another provision that was actually in the bill that amended language in the PERL is there was a provision that allowed you to cost share and have employees pay part of the employer contribution. It previously had been tied to a benefit improvement, so you could only take advantage of this provision if you improve benefits, and you can have that employee pay part of the cost of the benefit improvements. Now, this has been amended so it no longer is tied to benefit improvements. You can contract for this cost-sharing arrangement for any reason. You can also do it by benefit formula or tier. It used to be that you had to apply to everybody in a member classification. So if you want to do cost sharing for your miscellaneous employees, it had to apply to all miscellaneous employees across the board. So now if you have multiple formulas, which all of you will have after January 1st, and some of you may have 2 or 3 different formulas, but it would allow you to actually have cost sharing agreements by formula and also then by benefit tier, which is something new. So, I mean by collective bargaining unit. Before, again, you had to be by the entire member classification. Now you can do it by bargaining unit. And on this piece, when we at CalPERS talk about cost sharing of employer contributions, we will always be referring to this provision in this statute where you're formally doing it through your CalPERS contract.
Okay. So if we're going to have member contributions that are linked to the normal cost, there's just one thing I'd like everyone to understand is that member contribution rates will no longer be the same like they are today set in statute. They will potentially move, not necessarily on a yearly basis, but they will be subject to change over time. There are 3 things that basically now going forward will impact member contributions. The 3 things that play a role in the normal cost. The first one are the actuarial assumptions that we use as actuaries to set your rate. So in the future, for example, earlier this year, our board adopted a lower discount rate that resulted in an increase in the normal cost. Going forward, when our board will contemplate changes in assumptions, one of the consequences, if a change is adopted, could be either a reduction or an increase in member rate, depending if this change causes an increase or reduction in the normal cost. So that's one thing that's important to understand. The second one is the benefit package you offer to your employee will play a role. So if you have, beside the formula and the final compensation that's set now by statute for new members, other benefit provisions like cost of living adjustments, survivor continuance, these are all going to play a role in what your normal cost is and will potentially impact the member contribution rate. The next one are your plan demographics. This also plays a role in what the normal cost is for your plan. And the reason I put this table here, this chart, was just to show you, if you look at the rows at the top, this is just a range of what we see today for the existing formula of what the normal cost is. So if you look at the 3 at 60, it's anywhere between 19 and 22, which means for some employers, half of the normal cost is going to be about 10, for some about 11. I just want you to know that the same thing is going to happen with the 2 at 62. Right now, we've looked at if we got a lot of questions this week. What is going to be the normal cost for the new formulas? We haven't had a chance to look at all 2,000 employers, but the few that we've looked at, looks like it's going to be in the 12% range. By the time we're done, I wouldn't be surprised if it's somewhere between 11 and 13 or 12 and 14, but just want you to know that it's not going to be the same for every employer. So that's one important thing to keep in mind. And this next slide here, just the same thing again for the safety formulas. And we see even more variation there. If you look at the 3 at 50 today, we see a total normal cost ranging between 28 and 37%. Same formula. So we may see the same thing for some of the newer formulas. Again, we've looked at the 2 at 57 and the 2.7 at 57. And you can see right there that right now what we're seeing is about a 17% total normal cost for the 2 at 57 and about 21 for the 2.7 at 57, which if now the law says for new members that they have to pay the greater of half of the normal cost of what similarly situated employee pay, on this one, half of the normal cost for the 2.7 at 57 is 21%. So that's, if it was half of it is 10 and a half. So for the new members that are in the 2.7 at 57, they have to pay at least potentially 10.5%. So, and again, it's going to vary by employer. So what we are going to do over the next few months is, so for your current members, as I mentioned before, it will be shown in your evaluation report. You will be able to see what the total normal cost is for your current members. For new members, we will be sending later this year a letter to every employer telling them, for your new members starting January 1st, your benefit formula is, for example, 2.7 at 55. Your member rate is, so we will provide you what the member rate is and what the employer rate is for these new members, so that when January 1st comes and you hire a new member, you will know what the member rate is for them and what the employer rate is for you. We've had some questions this week with respect to, am I going to see a lower rate starting January 1st for the new members? If you're familiar with how we currently handle lower tiers of benefit at CalPERS, we will continue the same practice. So if you are a pool employer, your new members will be going into the new pools that we will create, and you will have a new lower rate for those new members. If you are not pooled, we will continue the same practice, which is to have you pay the same rate initially, but that rate will slowly reduce over time as you hire new members and we adjust our rate in the evaluation process that we do every year. So that's how it's going to be done initially.
Okay, moving on to working after retirement. I know there was a number of questions in this area, and we'll try to address many of them. However, there's one area that we will still be unable to answer at this point in time. First, this does apply to all retirees, anybody that has retired or is going to retire in the future. These restrictions only apply, though, to retirees that try to be reemployed within the same retirement system. So what that means is if you bring in a retired annuitant that retired from a CalPERS covered employer, then these restrictions would apply. If you bring someone in from a 37 Act county or another retirement system, these restrictions would not apply, or vice versa. If you retire from a CalPERS covered employer and go work out in the private sector or go work for an employer under another retirement system, then these restrictions do not apply. There are many of the provisions in this that were added in AB 340 are consistent with the retired annuitant provisions that are already in the PERL, so you should not notice a change. We already have limited reasons for appointing someone as a retired annuitant. The 960-hour limit is still already part of the PERL. It requires an hourly pay rate, and also you have to be paid the same as the similar duties that person is doing. So those are provisions that are in AB 340 but are already consistent with how we operate the retired annuitant program within the PERL. The bill does, though, add some new restrictions and limitations. Obviously, the biggest one is this 180-day waiting period. A lot of questions on this. I think we are clear that if a person retires in 2012 and seeks employment as a retired annuitant in 2013, that 180-day waiting period would apply. So it would go back to their retirement date. The one area where we're still unclear as to the actual implementation is that area of someone that has retired in 2012 and had already returned as a retired annuitant in 2012. We're not quite sure how the language is supposed to apply to that situation. We're still researching it and hope to have an answer soon on that. There are exceptions to this 180-day waiting period. The employer could have a certification process and approve an exemption to the 180 days. If the retiree is a safety employee, they would be excluded from the 180-day waiting period, and for those individuals that are in the faculty early retirement program. If a retiree receives some type of retirement incentive when they go out to retire, then they cannot get a waiver on that 180-day waiting period. I think another big change on this is it does include independent contractors. So that is something new. In our provisions, it only dealt with basically retired annuitants or people that were employed by that employer. But this does include independent contractors. So it'll be something you'll have to get used to. And then finally, I just want to point out that the bona fide separation rule would still apply. And this is a federal law. We have regulations that we've adopted that says if someone retires below the normal retirement age, then they have to wait 60 days before they can return to work. So that would still apply and trump this 180-day exception. So even if you were to get a waiver from your employer on the 180-day, or if this person happened to be a safety employee or a FERP, they would have to still follow those regulations we have adopted. Now, there is a provision to get a waiver to the bona fide separation in 60 days if it's an emergency. So there's still a process to go through. I imagine it's much stricter than the one to get a waiver to the 180 days. So that's just something to be aware of if you have individuals that are coming back that have retired below the normal retirement age.
Okay, so there are other provisions that the law impacts. Most of you should be aware by now that effective January 1, 2013, the purchase of airtime or additional retirement service credit will go away. So if you have any members out there that are looking or considering purchasing it, their valid request does have to be in the system and in CalPERS on 12/31. I think if you attended the service credit purchase session yesterday, you heard Matt say, please don't have them wait till the very last day to submit that, so we'd appreciate that they get that in a little early. It must be a valid request, so everything needs to be filled out. And in order to receive it, the member must have 5 years of service credit by December 31st and be actively employed by a CalPERS agency at the time that they submit the request. In addition, it prohibits retroactive benefit increases. However, the law does exclude the COLAs, the cost of living adjustments. But it does say that any optional benefit provisions that are service-based will also not be allowed. Right now, we're in the process of going through the optional benefit provisions we do have available, and we will send out a list to the employers once we've determined which ones will still be applicable as we move forward.
The bill also now prohibits pension holidays. Basically, it says that the contributions received by CalPERS in any year cannot be less than the normal cost of the plan. They added some exception to this rule. We probably currently have about 30 to 40 employers at CalPERS that still have a surplus in their plan and pay today less than the normal cost of the plan. The bill, as I said, added some exceptions. We will be going over the next few months. If you're one of those agencies right now, we don't have an answer yet as to whether or not you will have to pay more. We're going to be looking at these exceptions to see if you qualify, and we will start implementing this for July 1st next year. So if you are one of the agencies that's affected, we'll let you know as soon as possible so that you are aware and you can budget for the fact that you may have to start sending more contribution to CalPERS starting next July. The next provision I want to talk about is there was actually a benefit improvement included in that pension reform bill when it comes to industrial disability retirement. They basically added a benefit that, an improvement that could result in a benefit for it's mostly geared toward a safety individual that would go out on industrial disability before being eligible for service retirement, so before age 50. Right now, the industrial disability benefit is 50% of final compensation. It now says that you get the greater of the 50%, or an actually reduced benefit, your actually reduced retirement benefit you would have received at age 50. Basically, it may result, for example, in someone going out on disability at age 47 to receive something like 60% of final compensation instead of 50. So that will be effective for any industrial disability retirement after January 1st, 2013. And currently it has a sunset date, and it would end on January 1st, 2018.
So the next provision, equal health benefit vesting. A couple things I want to point out on this one. The bill really just deals with the health vesting schedule, so it does not prevent you to necessarily maybe have different health plans for your different groups, or to have different contribution amounts. So it's really about the vesting schedule and making sure that your management employees do not have better vesting schedules than the folks that they supervise. And I probably had to go back and correct myself from something that I said yesterday. Obviously my goal is to say the same thing today as I said yesterday, and hopefully not say anything different. But I think there was a question yesterday in the ledge session about the health vesting and whether or not it applied if there were no represented employees at that employer. And I think if you go back and read the law, it really talks about the management, executive staff can't have better vesting schedule than the employees that they supervise. I think, and it's regardless of whether those employees are represented or not represented. So that is something that you'll need to look at as far as your groups and what your vesting schedules are. And so it's really looking at how many years do you need to work and provide retiree health care. So if you have, you require someone to work 10 years to get retiree health care in management, then you got to have something at least that same level for the employees that they supervise. For PEPRA, we will be looking at providing some conforming language to make sure that those of you who do contract with us under PEPRA, that we have that kind of lay out how we're going to implement that provision. And so we're almost just a few more provisions before we get to some questions. The bill adds a felony benefit forfeiture. It adds a provision for people that are hired after January 1st, 2013, but it also adds a provision for anybody that is currently employee It does tie the felony to being job-related, and you would have to basically give up any retirement or benefit that you earn from the date of the commission of the felony. So it doesn't necessarily require you to give up your entire pension. It goes only back to the date of the felony. Did not get a lot of, I don't think we got any questions on this one, so that was good. So won't spend too much time on that. The next one is this contracting agency liability for excessive compensation. I think the easiest way to explain this one, this is a bill that was introduced by Assemblymember Gatto because he represents Glendale. And not that I want to bring up the city of Bell, but we did have a good story today in the paper about it. But this came out of Randy Adams, who worked 20 years for Glendale, got hired by city of Bell, doubled his salary, which increased the pension liability for the city of Glendale because of using the highest salary. So this is a bill that would require that if an employee is determined to, or if an employer is determined to provide someone an excessive compensation that increases the liability for a subsequent employer, that employer that paid the excessive salary could be on the hook for that increased liability. This will require at some point in the future for the actuaries to develop some regs or recommend some regulations for our board to adopt to administer this, but this is something that we will be looking at implementing and those regs down the road as we focus on some of the more important areas of the provision that go into effect on January 1st. And then the last one, we did get a question about this. It's the final average compensation for local elected members. This is a provision that was added for those folks that are city council members or board of supervisors, so that when they earn service in those positions, that service is is segregated, and then they only use the compensation that they earned in that position to calculate the retirement for that. So, for example, if you have a city council member who works 10 years as city council and they're only getting paid $800 a month, that 10 years will be based on that $800 a month salary. So if they have service or salary in another public agency, they don't get to use that highest salary. So I think there's some questions about how this would impact someone that's elected this year. So this is actually a provision that has been in our law for a number of years, I think back to 1997, that we've added. So they actually copied this from our law and put it so it apply to all retirement systems. So there's really no change from how we operate final compensation for these local elected officials. Okay. So that kind of ends our prepared presentation, and we wanted to go ahead and go into some questions that we have already collected from you. It does appear that we will have time for taking questions from the audience, so if you want to start thinking about what those questions are. And I know that Jenni has been sitting up here patiently, so I'm going to give her the first question. First question was, what lawsuits have been filed that will likely have an effect on the January 1st, 2013 rollout date?
Morning. We're not aware of any lawsuits at this point. That doesn't mean that there aren't any, but as far as we know, we're not aware of any.
Okay. Next question is for Karen, and it reads, I have an employee who has 5 years in STRS and 15 years in PERS. Does the pension reform affect the PERS to STRS relationship? They were considered year credits toward retirement. Has this changed?
So the new legislation does not change any of the current provisions that we have for reciprocity, so it wouldn't impact it. You get the next one.
Yeah.
You're going to give it to yourself.
Well, I think I answered. So I have a question here for David. An employer is enrolled in Social Security. Benefit is not coordinated with PERS pension. Which pension cap applies to that employer? And you might need to explain a little bit about that question.
Yeah, basically for those of you that may not be familiar with it, sometimes we refer to it as the offset. When you contribute to CalPERS as a $133 offset on a monthly basis. So the question is, my members are in Social Security, but I have made a contract change with CalPERS to not be coordinated with Social Security, so that offset does not apply. So the question is, with this new PEPRA, does the compensation cap applies to me? or what is the compensation cap? And the answer is, we're going to look at, are your members in Social Security or not whether or not you have an offset with CalPERS. So if your members are in Social Security, the cap is a Social Security limit of 113. If they are not in Social Security, then it's 120% of that cap.
Next question is for Karen. Does PEPRA eliminate the provision that allows an employee to convert sick leave credit to service credit? And do any other benefit options cease for current employees?
Okay, again, the new legislation does not impact a member's ability to take their sick leave credit and convert it to take their sick leave and convert it to service credit. And any benefits that are in place as of 12/31 will remain for our current employees. So it has no impact to them.
Okay. And then we had several questions, and so I won't read them, I'll just kind of paraphrase them, but we had several questions about when you hire an employee and you're trying to determine, is this person a new member or are they an existing member? I guess at CalPERS we're starting to call them classic members, so you can let us know if you think that's a good word. So you hire someone and you're trying to decide, is this a new member or is it a classic member? And especially if they're coming from another system. So Karen, can you kind of explain a little bit of how we can help the employers make that determination?
All right, so if you're hiring a brand new employee who's never been participating in the retirement system, or you're hiring an employee that's coming from another CalPERS agency, the MyCalPERS system will be able to identify what benefit structure and what formula to put that new member in. If you're hiring someone that's coming from a reciprocal agency, we're going to be enhancing the enrollment pages in MyCalPERS to allow for a field for you to identify where the reciprocal agency is, but you will need to get that information from your member. However, we'll, over the next couple of months, be looking towards developing some tools and some processes that we'll share with the employers to help make that a more expedient process. So you'll hear more about that in the future.
Okay, so then I have a question for Jenni. It says under the pilot IDR program, and I think that's the IDR provision that David explained a little bit earlier, is the 50% of the IDR still tax-free if someone has enough service and age to make their retirement greater than 50%?
So yes, that first 50% would still come to the employee on a tax-free basis. If the benefit's higher than that, in the example David gave, if it's 60%, that additional 10%, the delta, will create a taxable event, but the first 50% would not.
Okay, so then our final question, and again, I'm kind of paraphrasing because there's several questions in this area, and it's for David, and it has to do with the pensionable salary cap. There was questions about whether or not employer or employee contributions would stop once an employee hit those contribution caps.
So on this one, for those of you may or may not be familiar with it, prior to PEPRA, there is already a compensation cap in place today. It's the one set by the IRS. It's the 401A-17 limit that is about $250,000 today. We intend to continue the same practice we do today for that limit, which is we currently cap member contribution to the 401A-17 limit. So we will continue to use that same practice and cap member contribution for new members to these new lower limit. For the employer contributions, we currently today do not cap employer contributions. We keep collecting employer contributions above the cap. We had several questions coming to us at the booth and in some of our sessions earlier this week, and what I told to the answer I provided is, even though we still collect employer contributions, when we set your rate, we take that into account. So we don't necessarily collect more money from you. We basically implicitly set a slightly lower rate, knowing we will continue to collect money above the cap. And we intend to continue the same practice going forward, at least for the next 2 years. We will be looking internally whether or not it makes sense to change the practice going forward. But if we do, it's not going to be until 15, 16 fiscal years. So at least for the next 2 fiscal years, we will continue the same practice and not stop employer contributions above this new lower cap.
Let me just add, for those of us who aren't actuaries, I found this very confusing, but I think I finally got my head around it. So jump in here, David, if I have it wrong. But I think as a practical matter, we're not collecting the additional contribution from the employer. It's built into the rate, the cap, the lower benefit is built into the rate. And so at the end of the day, neither the employer or the employee are paying those additional contributions. Is that right, David?
Correct. Yeah, we'll, in fact, in the calculation of your liabilities, we will take that into account. So basically, you'll have lower liabilities because of the cap. But for administrative ease, we will be setting a slightly lower rate, knowing that we will keep collecting the contributions on the higher cap, but it will be reflected in your liabilities.
Okay. So, we obviously collected many questions around the area of member contributions and what will new members pay if they, I have an MOU that says X, or I have a cost sharing agreement that says Y, and questions about what can be included or not, in special comp. And so again, those are areas where we are still trying to decide what is the best answer, and again, working with the other, looking to team up with the other retirement systems to make sure that we're all doing it the same. And so if you wrote in those questions, we didn't just skip them on purpose. We just don't have an answer to give you right now. And I think the worst thing that we want to do is give you an answer and then have to tell you 2 weeks or 3 weeks from now that we gave you a wrong answer and we're changing it. So hopefully we will be able to start putting out the answers to those questions over the next couple weeks on our webpage. But I did just want to let you know that we didn't just, ignore them. We know they're there, and we know that's a big issue for you as employers as you're trying to develop your systems and reprogram your systems. And so we are working diligently and as fast as possible to provide you those answers. And so that ends the answers that the questions that we had kind of gathered. So if we can take some questions from the audience, if anybody has any questions, and we will find our.
Over there. We have a.
I don't. Better.
Hello.
Oh, sure.
Thank
back
you.
There, back.
Regarding equal health benefit vesting schedule, I need clarification, as our district currently has 3 tiers for health benefits, not related to representation though. It differs with regards to coverage, so maximum of 100% and 80%, and depending the hire date, whether there is an employee share. Would we not be in compliance with this? Because it's stated as a title of non-represented and representative employees. We're all one group, but because depending on the hire date, we have 3 different health benefit tiers.
I think it would depend. We would probably need more information to answer that specific question. But what you would need to look at is which employees fall into those groups. And so you could have a situation where you end up having the managers and executives in each of the 3 groups you mentioned, or they could cluster into one of them. And so that's going to go into whether you've got a favoritism situation that would offend the rule. And then the second thing I think you'd need to look at is, PEPRA refers to these related retirement membership classifications. So I think we would need to drill down further into those facts you mentioned to see if those 3 different groups are different membership classifications or if they're the same.
Thank you.
Way over here.
Just a clarification on airtime, on purchase of airtime that's going away January 1st. If somebody does not have 5 years service credits before the end of this year, they will not be eligible to put in an application. Is that correct?
That is correct. However, if they have service prior to membership, other types of service credit that they may have requested that we haven't had an opportunity to provide, as long as those requests come through and if they're approved and that gives them that 5 years of service by the end of December, then we would include that.
Thank you.
Right here in front.
Hi, thank you for this opportunity to hear all the information that you have. It is very helpful, but I am still confused, unfortunately. On the current employees, I thought that the employer had 5 years to have them contribute to their portion of the cost of retirement. But I think I heard you say that it's not going to be mandatory, that as an employer we can impose it or not.
Yes, that is correct. It is not mandatory that the employer require or impose that the current employees pay above their required contribution amount or half of the normal cost. That was just a tool that was added that would allow an employer who chooses. So, I think the goal is that over the next 5 years, that employers and employees will, through collective bargaining, reach some of these agreements to increase employee contributions. But if they don't, then the employer then could, if they choose, to impose that additional contributions up to those caps. So, and I also should have added that those caps only apply if the employer chooses to impose. They can actually, through collective bargaining, agree to amounts above those caps.
Thank you.
Danny, I'm over here, Priya Mathur. I sit on the board, actually. I just wanted to ask you to clarify what you were talking about in terms of employer contributions to above the cap to defined contribution plans or deferred compensation plans, because I think you used defined contribution when you meant deferred comp. So if you could just go back to that slide and clarify.
Okay. And this is probably not an area that we are experts in, but what my understanding is, if, let's just say, for example, the employer contribution, these are new members where generally we will say obviously that the employer and employee are each paying half the normal cost. So if we use David's example, that total normal cost is 12%, and both employees and employers are paying 6%. My understanding is if they offer a defined contribution plan or DC plan to these employees that hit the cap, the employer cannot put more than 6% into those plans, because they have to use the same contribution level or rate that they're putting into the defined benefit into the defined contribution. So they can put less, obviously, but they can't put more than 6% of pay into those DC plans.
And I think the PEPRA contemplates a deferred compensation plan, which would be something different. There's a lot of different types of plans. They're generated usually by the tax code, and PEPRA doesn't in all cases follow the terms used in the tax code. So I think that there's a field of different arrangements that in theory an employer could contribute to above those caps up to that amount that Danny mentioned. CalPERS is going to be limited in terms of what you could do with us, but certainly there's going to be options that employers could explore on both the deferred comp side and a DC plan.
Under the new member definition, what is contemplated for other public retirement system members? Is it state retirement system that are named, or any public retirement system like the federal government or anybody else?
The way the definitions work is employer is defined as being California public employer. So that, and then that ties back into public retirement system is defined with reference to public employer. So at the end of the day, it's a California public retirement system. It's not, so when we say somebody has never been a member of a public retirement system, it means a California public retirement system.
Thank you. A second question on the 12% and the 11% difference. Can you give an example of the other safety member on the 11% category?
We're still looking into it, but I think currently today, I think where we see like a lifeguard, we have some safety lifeguard position that I think would potentially be an other safety, but we're still looking at that list to see, but this is one example.
Hi, I was asked a question this morning by an employer that I could not answer, and that is whether a retired employee who committed a felony prior to the enactment of this legislation will give the employer remedy now against that employee's pension.
Pat, I think unfortunately we can't answer that question either. I'd want to put more thought into that before I gave an answer.
Danny, we have a question on your right-hand side.
I have a question about the potential for discriminatory hiring, because by having two different pension plans in place, in effect, we're creating almost an age discrimination for the classic employees who may be well qualified for a position that opens up at my agency, but who's worked at another CalPERS agency, and so is considered a classic member, which confers a higher cost to my company or to my district to hire that person versus hiring someone who would be considered a new member. So I've got a question about what kind of liability that creates for me as an employer in terms of age discrimination.
I think you raise an interesting question, and maybe the bigger question you're raising is when you now have these two different sets of rules and you have a potential workforce that could be both old members or classic members and new members, are you going to create some potential pitfalls for employment discrimination? And I think it's really going to depend on the facts and circumstances, and certainly that possibility would appear to be there. And there's going to be a whole myriad of different laws that govern that employment discrimination context, and so I think you'd have to look to your employment counsel to tell you where you might be hitting a pitfall with that. And I don't think it's going to be a black and white answer.
Talked about special compensation. Whatever changes you do come up with, will those affect old and new members?
No. For the classic members, we'll start calling the classic members, the rules do not change for those. So whatever the new rules as far as what can be reported as pensionable compensation would only apply to those that are new members, that meet new members' definition.
The other question I had to do with what Priya said, that basically if you're doing a defined contribution plan and you're using a 457, doesn't that get limited strictly by the limits of a 457 plan?
Yes. So let's say that you want to supplement a new employee, a new member's benefit by making an employer contribution to a 457 plan. You're going to have several different constraints that come into play, and you would have all of the federal law constraints that already would apply to a 457 plan if that's the mechanism you're using. And you would also have this additional constraint of that Danny mentioned where you can only apply that mirrored rate to the additional comp. You would also have the third constraint of whatever that plan provides. So if you already have a 457 plan, it would have to be consistent with the terms of that plan, or that plan would have to be amended.
You discussed an equal health vesting schedule for management and employees and offering the same benefits for retiree health care. And I'm just curious, if you do not have health care under CalPERS, will this affect your agency?
Yes, this provision was put into the general government code section, so it does apply to all public employers and employees. So regardless of whether or not you're getting your benefits through the CalPERS health plan, it would still apply.
IRS sets the limits that allow the employees to make pension contributions as pre-tax dollars under 414H2. How are these additional contributions under the share of the cost going to be impacted by tax laws?
That's a good question. So the question goes to the 414H rule, which we call a pickup rule for tax, and how do you get these additional contributions into the plan on a pre-tax basis? So we think that the pickup resolution that you have all as employers adopted is going to cover these new mandatory contributions that are going into the plan. To the extent there's cost sharing, we may at some point tweak that resolution to make sure it's broad enough, but we don't think that come January 1st, now we've got a 414H problem with respect to that. So for now, those resolutions are fine, and we'll probably continue to look at what it means when there's a cost sharing component to it.
Yes, hi. I'm just back on the earnings cap on contributions. Do I have to have in our payroll system a method that once they reach these earnings caps of 113.7 or 136 where contributions stop for the employee? I think you mentioned the employer share, you're going to continue to collect contributions. But do I have to have something in place to where it stops contributions on the employee side?
We're basically asking ourselves, how do we do it today? Because I know,
We'll have it. We would like to phone a friend. Can we get
Thank you. Anthony Sweeney, Chief of Benefit Services Division. I just wrote this example for Vina here, so you can get copies of it, but it addressed that question exactly. So, right, you would continue to report the full pay rate and earnings for that individual, and then as those earnings reach the cap for the year, then you would stop the contribution. So yes, your payroll system would have to limit it, and if you didn't, our system would give you a warning or reject that payroll record when you reach the cap. So the example was $240,000 a year. So for 6 months, I think we had full reporting of earnings and contributions. And then the next month, half. This is somebody who's not covered by Social Security. So then the next month had full pay rate and earnings, but half the contributions. And then every month after that through the year would be zero contributions.
Currently, we pay for our employees. So my question is we hire someone as a new member, is that contribution, or that amount of money that's coming out of their check, is that going to be pre-tax, post-tax, our choice, their choice? How is that going to be handled?
I assume you mean the member contribution,
right? The member contribution, is that, how is that being, since we haven't been doing that, how is that going to come out of their check?
So it would depend if you've adopted the resolution I just referred to that we call pickup resolution, and this is different from EPMC. This is it would reference 414H in it of the tax code, and it basically says that for tax purposes, the member's contribution is going to be treated as if it were made by the employer, which means that those dollars go into the plan, those member dollars go into the plan on a pre-tax basis. So if you've adopted that resolution, then those dollars would come in on a pre-tax basis. If you haven't adopted that, then you'd want to do that probably immediately so that you don't create that problem for your new hires that you have come 1/1.
Thank you. That answers my question.
Thank you for taking the questions. This is kind of a collective bargaining question. We're an agency that's going to have 3 tiers by January 1, and we currently have MOUs where our employees are paying in excess of what the statutory maximum's going to be. So say they're paying 10% already. Will the people in the new tiers, the second tier laterals and people after January 1 have to pay the 10% because they're in the same bargaining unit as the others, or will they just have to pay what the statutory maximum is?
I mean, that kind of falls into that area where we're still not sure. That comes down to what you define similarly situated employees. So I think there is the possibility that those new members could pay that 10%, but we're not sure yet.
My question was along the same line. We have a split workforce. Some of them are covered by a collective bargaining agreement, and the other half is not. They're non-bargaining unit. So is it my understanding that after January 1st, those new employees who are in a bargaining unit position will have to pay whatever percentage of member contributions, or are they covered under the current collective bargaining agreement, and are non-bargaining unit employees going to be paying a different rate?
So it's a little bit more complicated than that. The way PEPRA works is the new member contribution rate of 50% of the normal cost and the prohibition on EPMC apply to your new members effective the first of the year, unless an MOU is impaired. And then they don't apply to the extent that MOU is impaired until such time as the MOU expires or is amended. So whether or not your MOU is impaired is a question that you'll have to answer. And that's not something that CalPERS will be able to determine. And frankly, the employer, as well as your union representatives, you're going to be in the best position to determine whether there is an impairment. And it's really going to depend on what that contract says, and then how it plays out in terms of what happens to the members if you enforce the provisions of PEPRA, despite the contract. So we will have some procedure in place where you can tell us the 50% rate doesn't apply to us yet because our MOU is impaired. But we will not be able to make that determination for you. We'll look to you as the employer to tell us whether there's an impairment.
I have a couple of questions. This pension reform is going to require that we rewrite our payroll program, but we can't do so until we get guidance from PERS and STRS as far as file specifications. So are there going to be any changes to the PERS file specifications, or should we start the reprogramming portion of the PERS reporting?
No, PEPRA is not going to require any file format changes for my CalPERS.
Okay. And then because it will take some time for us to program our software, can I request an extension for my next year's payroll files now?
Let's take that conversation offline.
So my question was going to be along the same lines. Can you give us a timeline as far as system change updates with my CalPERS, and then maybe membership enrollment form updates?
So right now we have a team back at headquarters that are working through some of the system change issues, and we get periodic updates, but it's going to take us probably another couple of weeks before we have a definitive answer. But as soon as we know, we'll get that information out on the website.
Thanks.
So with regard to the system, will all of the new contracts be available so that we can enroll our new members, get a CalPERS ID, so then we can go and enroll them in health insurance?
That is our intent, to get everything loaded and be ready on January 1st.
Okay, and will there be a workaround if, because the health insurance is going to be the issue, I believe.
I don't know at this time. Like I said, we're still working through some of the system issues and how quickly we can get that up and running. But if there are any workarounds or if there's any special instructions for employers, we'll make sure that you're well aware of that. There probably will be a series of circular letters that are going to be going out to employers once we do finalize the information. And so I can't tell you when that's going to be, but we will get the information out to you as quickly as we possibly can.
Hi, I had a question or a clarification for Anthony's situation. If that employee reaches the limit, you still have to do the employer contributions, so it's not 0%, correct?
Correct, yeah, it's only for the member contribution. We were still collecting the employer contribution on the full earnings.
Question here to the left.
I thought I was getting this, but now I'm pulling my hair out. So for our classic employees, if they're currently paying nothing, is it required by 2018 that they must start paying up to the 8% and then have the option of going before that, or they can continue to pay nothing?
All right. I'm sorry, but could you repeat the question?
Well, we're currently not contributing anything to our employees. Contribute nothing.
Okay.
So by 2018, is there a requirement they're going to have to pay something?
No. So for current, I mean, I think for current employees, classic employees, it's pretty much the status quo. You can continue to operate, the same way. If all the 2018 date says is the employer may impose employee contributions as long as they've gone through the collective bargaining process, and hit impasse, and followed all those steps. So it can't be just 2018 comes and you impose it. I think they want you to collectively bargain and try to get there through collective bargaining. But if you can't, then you can impose contributions by the employees up to those caps. Okay, well, I think that will wrap up the questions.
I just want to give one more round of applause for the panelists.